Good evening, everyone. We're going to get things started. It's a little bit after start time. I just want to welcome everybody on behalf of Council, staff, and the Healthcare Coalition of Grand Falls-Windsor to this important event. As you know, healthcare is in a lot of trouble these days, and there's a crisis around us, and everybody's impacted by it. And we wanted to talk about that here this evening. We wanted to give you some information from our perspective, talk a little bit about that, and then we give the audience an opportunity to ask some questions, make some comments. And beyond tonight, because always I know there are people that may not want to get up in front of a crowd, there will be opportunities for you still to have your input, to ask questions and that sort of thing. I think seeing such a large crowd, and we've had calls today from people obviously disappointed that they couldn't get in because we had to close registration. And as you know, the event is being recorded now, so at least we'll have it recorded and be able to replay it on the different medias that we're able to do so, and we will be able to reach whoever wants to take in tonight's activities. And I'd like to welcome as well the communities around the region. I know there's several communities around the region that are represented here tonight by council members, mayors, etc. And it is a regional issue. We know that. I mean, it's not just a Grand Falls-Windsor issue. This is a regional issue. And as we know, what happens in Grand Falls-Windsor and our hospital impacts everybody in the surrounding communities. Just as when you look at issues that exist in the surrounding communities, those are our problems too. So, you know, part of the exercise here tonight is to get people together to try to inform as best we can about what we've learned and what we're expecting to come and what we need to be doing. And we thank you again for coming. Just a bit of housekeeping, I guess. I'd like to remind people to turn their cell phones off. And we'd ask that you didn't do any video recording. So this evening, the way it's going to go is we're going to take we're hoping about 12 minutes each for Cyril Farrell, who's the chair of the Grand Falls-Windsor Healthcare Coalition, to give you some background on what they've been up to in the last year and a bit. And then Councillor Holly Dwyer is going to come forward for the same amount of time, and she wants to talk to you about a few important topics. And then I'll be back to have some comments as well with regards to the health accord, the role of municipalities in the health accord, and particularly what we're all, I think, most concerned about is the access or lack thereof of primary care. And that comes in many shapes and sizes and forms, so I'll speak to that a bit. And then after that, we'll have an opportunity to open it up to questions and comments, and we'll get more into the details of that at that time. So overall, we expect the event to take about an hour and a half, no more than 2 hours, okay? And we'd like to try to get everybody an opportunity to speak who wants to, but we will be conscious of everybody's time as well. You know, before I call Cyril up, we just want to make sure as a community, and we've been keeping a close eye on all the developments, the provincial governments, healthcare initiatives, the actions around recruitment and retention, the health accord, which is a blueprint for the future. What we want more than anything, and I think everybody in the province wants, is just fair decision-making that represents everybody in the province, that decisions will be made on fact-based, evidence-based data that is available. The last thing we want with a health accord that's going to be a 10-year plan, and probably beyond, is it to become a political exercise where decisions are not made for the best intentions, and the decisions become the wrong ones, and then at the end of the day, who suffers is the patient and the residents. And not only us here tonight, but this is a blueprint that's going to take us decades forward in terms of shaping our healthcare, as you know. And I will say, you know, we didn't invite any provincial government, federal government representatives here tonight. We just wanted to make sure that this was, again, an event that we had an opportunity to listen to our citizens and the citizens around the region. And nothing that's said here tonight is directed at the current government per se. They just happen to be the current government. It's directed at any government and any government in the future and what's important in terms of Grand Falls-Windsor and area and what we see as concerns. I will go ahead now and ask Cyril Farrell, who again is the chair of the Grand Falls-Windsor Health Coalition, to come forward. And then we'll move on to Holly and myself, and then we'll get into some commentary and questions. Okay? The last thing I'll say before I get Cyril to come up, and I think everybody is pretty well aware of this, but it needs to be said, is that obviously people know that healthcare and the delivery of healthcare is a provincial government responsibility, and the federal government as well in partnership through funding primarily, as we know, through the Premier's meetings this week, and hopefully something gets done there. So from our perspective, we're not able to answer some pointed healthcare questions. That's not our job, but we are here to listen, and we are here to take note of what the concerns and questions are, and we are here to represent the voices that are here. So with that said, I'll ask Cyril now to come forward and to give you a short presentation on the Grand Falls-Windsor Healthcare Coalition. Cyril?
Thank you, Mr. Mayor. And thanks everyone for coming out tonight. It's a great show, and I think that's certainly important. It certainly shows that people care and are concerned about healthcare in our town. First of all, I want to tell you who I'm not. I'm not a healthcare expert. I'm a concerned citizen like you, and I'm concerned about the state of our healthcare, and I want to have a say in where it might be headed. I'm here because I'm a consumer of healthcare, and as I get older, I'll probably need it more frequently. I'm also one of many, and I'm sure there's probably many in this room, who don't have a family doctor. Haven't had one now for about 14 months. But I'm an optimist, and I feel that if the health accord is implemented in the way it's intended, it will go a long way towards a long-term, sustainable future for healthcare. But it will take time, and as the Mayor mentioned, it's a 10-year plan. And there will be lots of bumps and humps along the way. There's no doubt about that. So with that preamble, what I want to do is give you a little context on the coalition itself, how it was formed and so on, and what we've been doing for the past year, and a little bit about what we plan to do in the coming year. I'm going to go back to August 2020. Andrew Fiore was sworn in as the new Premier. Shortly after he was sworn in, he commissioned two major studies. One was the Premier's Economic Recovery team, and it was led by Moya Green, as some of you may remember. The second major study that he commissioned was the Health Accord, and that was led by Sister Elizabeth Davis and Dr. Pat Parfrey, two very respected individuals involved in healthcare in this province. And then, after they were commissioned, there was a municipal election. And during the election, I remember hearing Mayor Emanuel, who was campaigning at the time, saying that if he was elected, he would make sure that the town was not affected detrimentally by some of the health accord things and so on that were coming down the pipes. And I guess it was shortly after after he was elected, I sent him an email and said, "You've made this commitment during the election. If you want some help with it, then I'd be prepared to help in some way." Never to know that I was going to be doing this here tonight, but here I am. So anyway, we went about forming a really good committee. I'd say second to none when it comes to committee and the level of experience and so on that they had to offer. They're a good cross-section of the community, and they have backgrounds that are very important to the goals of the committee. We're an arm's length committee of council, but we're volunteers, and we're supported by the town in such ways as arranging of meetings and those kinds of things. Anyway, I'm the chair, and then we have Marg Power. I think they're all here, or I don't know, I didn't see them all coming in. But Marg Power is here. Some of you may know Marg. She's a retired ICU nurse. Ruth Down Robinson. Ruth is a retired educator. Reg Hamilton. Reg is a retired journalist. Dr. David Sutherland. He's a retired urologist. We have Denise Spencer. Denise is new to the committee. She just joined us in January. But she will bring a strong Indigenous voice to the table, and with her law background, I think she'll bring a good analytical mind to the team as well. And then we have Holly Dwyer. Holly is here on the stage, and she's the council representative on our committee. Our terms of reference that were given to us by the town, and we did have some say in them, were to study and to research and investigate plans from the Health Accord, from the Moya Green Economic Recovery Commission, and the provincial government as it relates to healthcare. We were also asked to ensure strategies for reorganizing and reimagining healthcare are not detrimental to our hospital or to the quality of healthcare in our town. We're also asked to undertake efforts to advocate and engage with the community and the region on areas of concern, and where possible, to propose some solutions. Our focus has been very much on the Health Accord, more so than the Economic Recovery Commission, because we haven't really seen a lot of impact, I guess, at this point from that particular work. So the Health Accord recommends one provincial health authority for the province. There are currently 4, as you probably know. They recommend 3 regional hospitals, 1 in Central, but it's over 2 sites. So you can imagine that poses some interesting challenges. They recommend 7 community hospitals throughout the province, multiple health centers, 3 centers of excellence for aging, attention to the social determinants of health, and much, much more in the 256-page report. If I had to get into them all, I wouldn't get out of here tonight. But anyway, there's a lot of moving parts to all of this. So the first meeting of our coalition was in January 2022, and for the first number of months, we were in learning mode. We held meetings with the Health Accord co-chairs, with the Health Accord Aging Committee, met with numerous doctors. We met with the CEO of Central Health. We met with the transitional CEO for the Provincial Health Board, among many others. And we took time to read and reread the reports that the framework and the framework to improve healthcare. And as you can see from the slide behind me there, it talks about action on social determinants of health, elder care, community teams, reimagined health centers, new emergency model, hospital response, sustainability, virtual care, and so on. And within these, there's a multitude of recommendations. So as a result, we identified 5 areas of focus, as we realized very soon in the game that we couldn't take on the whole, a lot of recommendations that were in the Accord at one time. So our areas of focus for the past year were in the area of physician recruitment, 1 provincial health authority, hospital services, Center for Excellence for Aging, and collaborative teams. So I'll speak to you a little bit about each of those in a little bit more detail. On the physician recruitment area of focus, we realized very early in the game that we were not in the business of recruiting doctors. That's not our role. So our focus became one of advising the town on what they could do to support efforts to recruit and retain. We formed a subcommittee, Ruth Down Robinson, I think she's here somewhere, and Holly Dwyer. And they did a tremendous job in researching and preparing a report. They researched what was happening in other provinces and in other countries, in fact. And as a result, we put together a report for council that included 18 different recommendations of things the town can do to make it a place where doctors want to come and doctors want to stay. We understand that council has reviewed that report and that they are looking now at ways to implement some or all of them. And in fact, I think, Mr. Mayor, some of them are already being implemented. The Health Accord recommended one health authority, and government has set legislation for implementation on April the 1st of this year. In the beginning, we were very concerned about one health board. We were afraid that we were going to be swallowed up by the big machine on the Northeast Avalon. But we started to try to learn as much as we could about what one health board would mean for us. And because of the more we learned, we became generally supportive of the One Health Board. We feel that the One Health Board will bring coordination to policies, processes, purchasing, technology, standards of care, and a whole host of other things. We still have some concerns about rural and remote health care. We want to make sure it doesn't get lost in the larger system. However, with the plan for 5 regional councils to go along with the provincial health authority, we think that they're implemented in the way they're intended. It should bring balance to the system so that the rural and remote regions have a strong voice. I'll talk to you a little bit more about that at the end, because I think there's a role for you. The coalition, as a result of the work it did, presented a report to council on that as well. We did an analysis of the One Health Board thing, and we made some recommendations to the town as well. The area of hospital services, we've been monitoring areas that have the potential of negative impacts on our hospital, and we've been expressing concerns. One of the areas, you'll hear a bit more about later from Holly, is around laboratory and pathology services. So I won't go into that. The other area that is concerning to us is around obstetrical services, because the Health Accord speaks to one obstetrical service for Central Region. And you've probably heard there's been a lot of discussion in the media recently on that. We have made the case to the Minister, to Dave Diamond, the transitional CEO for the Provincial Health Authority, that Grand Falls-Windsor, we feel, is the best site based on the history of a strong, stable service, and that it's perfectly centered. We're in the center of the Central Region, so it's equidistant for people to travel for service. We've also been identifying opportunities to support our hospital. And because we think there's a strong case for our hospital to be an acute care center, and we brought to the attention of the town, to the Minister, and to the transitional CEO for the new health authority. When it comes to the Centre of Excellence for Aging, there's going to be 3 in the province, and one of those will be in central Newfoundland. And these centres will mainly focus on geriatric and restorative care. We initially took a long look at that particular area of focus, and we wanted to learn what these were all about. And the more we learned, I guess, we decided not to pursue it as strongly as we have some of the other ones, because we couldn't ascertain what we may have to give up at this hospital to be able to accommodate it. Because we feel that this hospital could be a very strong acute care hospital. We will continue to monitor it though, because this initiative can have a lot of benefits for our town, and we want to ensure that we get the greatest benefit from it, even though it's not here. Actually, the health board speaks to that being recommended for the Gander Hospital, and we're generally okay with that, but we want to continue to learn what's going on. And finally, our focus has been on collaborative community teams. The Health Accord speaks to 35 teams for the province, and this is just the island portion of our province, obviously. And as noted on the map, the area in yellow covers the designated region for our team, which essentially goes from about Leading Tickles to Buckens. So it's a big area, as you can see, number 14. We believe, based on our research, that these teams will improve primary care delivery. We've expressed to the Minister, the transitional CEO, and Central Health of our desire to ensure our region is on the front end of implementation. We don't want to be number 35 out of 35. We know that Central Health, through the leadership of Dr. Jared Butler, has been advancing this initiative. We will continue to monitor progress and push the plan forward for early implementation. So here's a basic overview of what a community team might look and feel like. First of all, residents like yourselves would register to be a member of the team by calling Patient Connect in L. Or if you're already on the roster for a family physician, then you are already in the team. But like me, and I'm sure some of you, you're not rostered with a doctor, so you would have to call Patient Connect and have your name put in for the team. When care is needed, you connect with the team. There'll be an intake office, and you'll be triaged, and then you will be directed to the most appropriate provider of care to meet your need. And those providers are not always doctors. Although doctors will be there, and if you need to see a doctor, there will be provision for that, as I understand it. But the team will be made up of physicians, nurse practitioners, registered nurses, LPNs, allied health professionals such as physiotherapists, pharmacists, social workers, etc. So patients will be followed by the team through the use of electronic medical records, ensuring continuity of care. And I'm sure a lot of people have concerns about continuity of care in the current system, because you lose your doctor, and then, like me, your file gets sent off to Ontario somewhere for storage. So it certainly impacts continuity of care. So in our region, all the current clinics could eventually be part of the team, should the providers wish to join. And I understand that there's very strong support for teams among our physicians in town. So that's the 5 areas of focus. But there's one more non-specific area of focus for us, and that has been in the area of relationship building. Through our many meetings, we have taken the position that we want to build strong relationships, while at the same time letting decision makers know that we are keeping an eye on what is happening. And we have taken also every opportunity to provide input, like when there were town halls during the through the development of the Health Accord and so on. So we've certainly taken the opportunity to have input. So going forward, we plan to continue to build on what we've been doing in the first year. We will look at new areas of focus based on the Health Accord recommendations, such as regional, social, and health networks, and the role that our town can play in those areas. We're going to start looking at recruitment of nurses and healthcare professionals. In fact, Holly and Ruth and Marg have already started that particular piece of work. And we will continue to monitor activities affecting our health care and continue to advise the town accordingly. And there's also a role that we think that you can play. First of all, I'd encourage you to inform yourselves by reviewing the health accord, the final report, as well as the blueprint for implementation. They're big documents, but it's very important, I think, that people become aware of them and what's intended. I also encourage you to express your views on issues that concern you, to government, to the health authority, to MHAs, the Premier's office, the town council, to our committee. It's important to let people know if you have issues or concerns to help improve healthcare. And we want you to consider putting your name forward to serve on the new Provincial Health Authority, and the application for members of that new health authority are already published on the Independent Appointments Commission. If you go online and look that up, and I think you'll have an email address or website address or something for that later on tonight on a little handout. So consider putting your name forward to serve. There's also going to be regional councils. There's going to be a regional council for Central Newfoundland. I think that's going to be critically important for us to have a say in what goes forward to the provincial board. So put your name forward for that. And then there will be these regional social and health networks formed at some point. Again, put your names forward, because it's very important for us to be connected. So in closing, I realize that this is just 15, 16, 17-minute presentations, more than 12 that Barry said I was going to do. So it's only an overview of what we've been doing for the past year. And I'm sure you may have lots of questions or issues from what you've heard. So if you do, please come forward and ask your question tonight, or you can email us at an address that is on the screen here. So thank you for listening, and thanks for coming out tonight. So now I'm going to invite Holly to come and have a few words.
Thank you, Cyril, and good evening. Let me begin by reiterating what you've already heard. Council is in favour of the health accord. We all agree, and I doubt there's a person here that would disagree, that we need better health outcomes. As was presented in the health accord, we have the lowest life expectancy, highest death rates from cancer, cardiac disease, and stroke, and the highest rate of chronic disease. More seniors in Newfoundland have chronic disease than any other province. And we spend more per person on healthcare than any other province. And we have the worst outcomes. Our tax dollars fund a healthcare system that is not just performing poorly, it's the worst in the country. So kudos to the provincial government for taking the initiative to reimagine healthcare in the province. Absolutely necessary. Health system performance, the third circle that just came in, refers to how well a health system achieves its goals and includes things such as preventative care, access to health care, and administrative efficiency, among other things. And these are issues that I believe we are all concerned about and should be concerned about, and it's most likely the reason that many of you came out this evening, because you have these concerns, particularly accessibility to healthcare because of the shortage of family physicians. And because you do, we do too. I commend Sister Elizabeth Davis and Dr. Parfrey. As I commented in a meeting with Central Health, I trust them. Their recommendations have been made, and now it's up to government to implement them. And that's where our concerns come in. Concern that decisions could be made and implemented that are not based on empirical evidence. And while the Health Accord stresses the importance of fact-based decision-making, there are examples in the past where that has not been the case. And when decisions are based on anything other than fact, optimal outcomes are not going to happen, which has implications for all of us, not just residents of Grand Falls-Windsor, but for the central region and the entire province. After all, our taxes pay for this healthcare system. As Cyril said, and I'm sure Mayor Emanuel will explain further, the Health Coalition, led by Cyril, have been doing what we can to learn and make recommendations based on that learning, and to do what we can as a municipality to advance the Health Accord, but also to ensure that our interests as a municipality and as a region are protected, and we will continue to do so. We've earned a reputation for our interest and involvement, and for going above and beyond what might be expected for a municipality. Our Health Coalition is one example and proof of this, and there are others. But as I said, that doesn't mean we don't have concerns. We do. The lab services issue has been a concern for Council for some time. Prior to the Health Accord and the work Sister Elizabeth Davis and Dr. Parfrey set out to accomplish, we became aware of the lab services issue. It was early in 2020. We heard that there were changes coming in terms of where non-urgent lab samples would be tested. And then we discovered a request for proposal for new lab equipment, and the RFP listed James Payton as the lab hub. This was not a Health Accord decision. It was made before the Health Accord was initiated. We contend that it was the wrong decision, not based on fact, and we have made our opposition clear to Central Health and to the government, and asked that the decision be reviewed, citing numerous examples of how the criteria used and the scoring of those criteria were egregiously, blatantly flawed. This decision, which by the way has not yet been implemented, mainly concerns where non-urgent samples will be tested. Non-urgent samples that are collected here in Grand Falls-Windsor, but in other places that our lab currently services. Bayverde, Springdale, Buckens, St. Albans, Harbour Breton, Botwood, Lewisport, they all come here to be tested, couriered here daily from those sites. James Payton currently services 3 sites that are closer to them, Twillingate, Brookfield, and Fogo. But this lab hub decision will mean that all non-urgent samples, including those taken here in Grand Falls-Windsor, will go to James Payton for analysis. In 2018, an external review of Central Health was released, the Vaughan report. It recommended that evidence-based decision-making protocol should be used when implementing changes to clinical services. And we heard and read the same suggestion in the Health Accord. I'm not going to go through all 16 criteria that were used to make the lab hub decision tonight, but I will give you an idea of why we contend this decision is the wrong one. So a committee was struck. They had 16 criteria to evaluate on a scale of 0 to 4. 0 meant that it significantly misaligned with lab hub citing requirements, and 4 were top marks. The first 3 criteria were objective. There shouldn't have been a whole lot of discussion, not based on opinion. Population, distance to the hub, and number of acute care beds. In terms of population, we both scored 2, the same, even though we serve a greater population and our lab currently services a much greater population with samples from 7 sites coming here. The Health Accord, I think the population that they used there gave Grand Falls-Windsor, CNRHC, an extra 600 people. It really depends on, where you draw that circle and depends on what you read. But we have a greater population, yet we scored the same. In terms of distance to the hub, if this decision is implemented, the courier travel time of samples would be approximately 20 hours to James Payton and 17 to CNRHC. Approximately an additional 300 kilometers daily. We shouldn't shrug our shoulders at this when you consider that in 2017, and I'm pretty sure the price of gas hasn't gone down, Central Health were paying $175 a day for the Bayvert Courier alone. Yet, we didn't gain any points there, 2-2. In terms of acute care beds, it listed James Payton with 85 and CNRHC with 79. A quick visit to the Central Health website shows that this criterion is flawed as well. 85 for James Payton was correct, but it lists us as having 130. So James Payton got top marks there, somehow, and we scored a 3. The end result was James Payton scored 43 and CNRHC 31. And while the decision has not yet been implemented, it hasn't been reversed. The point I want to make is that decisions have been made in the past that simply don't make sense. And even when the evidence suggests a course of action, it doesn't necessarily mean that this is going to happen. We have to be keen, and being keen means having foresight and being super vigilant about what's going on. Decisions will be made that we might not like, but they have to make sense. When they don't, of course, we'll voice our concerns. That's our job as a municipality and as a region. And there are other things that we can and have done, and we're doing as a municipality. Positive things. When we invest in infrastructure, programs, and events, we're doing so recognizing that these things build community and impact not only the social determinants of health, but also professionals such as physicians and their families and their decisions to live here, to settle here, and to stay here. I serve on the Community Advisory Committee with Central Health, whose #1 mandate is physician recruitment and retention. And we have a very strong relationship built with them, and they know they can rely on us to go above and beyond. Town staff recently brought a physician on a tour of Grand Falls-Windsor. She's a nephrologist and was very impressed with the town. They brought her to the NL Dizzy and Balance Clinic, which generates research data for genomics based on R&D Center for Health to create more advanced vestibular treatment. It's set up in Grand Falls-Windsor in our Excite Center. And who knew that there was a relationship between kidneys and hearing loss? She was impressed. She moved here last month from England. Sarah and I developed a checklist that Central Health could have potential recruits complete so we know exactly where to bring them and what to do, recognizing the importance of tailoring our town tours for physicians to things that interest them and their unique needs. As Cyril said, one of the coalition's mandates was related to recruitment and retention of physicians. So Ruth Down Robinson, Cyril, and I formed a subcommittee to make suggestions to the town to help us achieve success as a community in recruitment and retention of physicians. Ruth in particular did a ton of work in this regard. We made 18 recommendations with action plans associated with each, and Ruth presented them to Council in December. Council is considering how to implement them, acknowledging that we're already doing some of them. We shared these recommendations with Dr. Megan Hayes, the Assistant Deputy Minister of Health Professionals, Recruitment and Retention in her department. We actually invited Dr. Hayes to our Grand Falls-Windsor Physician and Family Appreciation Day, but unfortunately she wasn't able to attend because of the impending hurricane. But the event did go ahead. We had 25 or 30 physicians and their families, about 100 people in all, took part in things like family gymnastics, family art, and stained glass classes, culminating the day with a picnic. By all accounts, it was appreciated. And you know, after the event, a resident physician who attended was on a national call with doctors from across the country and shared his experience praising Grand Falls-Windsor and describing the event. Another doctor on the call said, "We don't see that kind of support." I mean, you can't buy that kind of advertising, right? We partnered with Shalloway, the Family Physician Network, and sponsored an event for residents at the golf club. It was well attended by physician residents, not just residents in Grand Falls-Windsor, but surrounding areas, because we recognize that what's good for the region is also good for Grand Falls-Windsor. We planned an afternoon tea, 16 physicians attended, 2 were locums and 3 were residents. We made an impression. We have committed to offering 4 physician recruitment and retention events annually in our budgeting and planning. It's a high priority for us, and we hope It demonstrates our commitment and has positive results. To continue the work of the coalition, our subcommittee has expanded and now includes Mark Power as well, and we're looking at what we can do to help recruit and retain nurses. And we're already on it. In September, the town met with the new students in the School of Nursing, who are here at College of the North Atlantic, started their first year in September. They don't have as many supports here because being a satellite, having a satellite program, they just don't have as many supports. So as a community, we participated in their orientation. We gave a presentation about living in Grand Falls-Windsor, and of course our staff made it fun because while work is important, we wanted that event to reflect work-life balance. It's important to them, and they value that. We have a reputation for programming, and our commitment and ability to do that is difficult to duplicate. Most recently, we have brought more of an educational piece to our programs. We got plans in the future to offer a med lab camp based on a recommendation from our cord committee. The reality is that doctors recruit doctors, and we want them to talk about their experiences and why it's a great place to live and raise a family in Grand Falls-Windsor. In summary, we're making an effort, and we hope it will have an impact. Thank you for coming out tonight. Feel free to ask any questions related to anything I have explained here tonight. I hope you have a better understanding of our commitment to healthcare in the region and our expectations about the implementation of the Health Accord. I'd like to ask Mayor Manuel to come up now and speak about the Health Accord and access to primary care.
Thanks to Holly for all those great comments, and you can see how much work is going on, I guess, behind the scenes. Do this now. So the Health Accord, a lot has been said about it, and as we said, we've been following along since its start, and the town halls and the committee. What is a municipality's role? Well, we know a municipality's role is limited because we're not the decision makers when it comes to the decisions that are going to be made, the important decisions within the Health Accord. But I want to make it clear that we want to be willing partners. We want to be cooperating partners. We want what's best not only for Grand Falls-Windsor and our region, but the entire province. And we hope everybody else takes on that focus, because when it comes to the Health Accord, there are going to be a lot of changes. And we know we've got the Provincial Health Authority that's being amalgamated now, and in the spring, just a couple of months, will be activated. And then it'll be up to them and government to make the decisions that are necessary. But I really believe, and I expect that government will have this plan, that education and awareness is such an important activity for the government and the Provincial Health Authority to engage in. Because if people in the province don't understand what the changes are going to be and how healthcare is going to be delivered and how it's going to impact them, then they're not going to buy in. And if they don't buy in, you get opposition, then things tend to get political, and then decisions get made that not necessarily are for the right reasons. So I think education and awareness for all residents of the province is really important. And one of the buzzwords in the document, and by the way, I invite everybody to take a look at the Health Accord and read it for yourself. You know, it's a ton of information and it's a huge document, but one thing that's mentioned over and over again is the social determinants of health and preventative measures, preventative opportunities, and as you heard Holly say, and to take it a step further, I mean, I know from our perspective and other communities as well, have initiated programs. We've had over 100 new programs in the past few years, and everything from baby yoga to ballroom dancing. And anybody that's active on our Facebook page or you're connected with the community services department and may have family members and yourselves who are involved would know that. And the events that we've been having. Many events that there's been large uptake in, but it's all about trying to improve the quality of life for citizens. And we talk about the concerts in the park and the bouncy castles and things that are going on that provide active opportunities and healthy opportunities for our residents. Because obviously, if we have those activities and we can encourage participation, people will naturally be healthier, and that in turn takes the strain off the healthcare system. And, you know, for us, again, and you'll hear it over and over again, it's about fairness. It's about fairness in the decision making, and when this health accord is implemented, that the entire province is treated as they should be, and the decisions are made for the right reasons. And I think that's why we are so close to this, and we invited you folks out this evening. And we want to retain a lot of you folks in terms of a communication list, not to inundate anybody with any spam or to see emails coming every day, but to be able to keep you informed, to let you know what's going on as this health accord implementation continues, what our concerns are, to hear from you and your concerns, to provide more information, to ensure that we have strength in numbers, not only in Grand Falls-Windsor, but throughout the region, so that our voice can be heard. Because if we don't have a collective strong voice, then our chances of success are reduced dramatically. I just want to thank Cyril Farrell and the Commission, quickly the Coalition. I know you heard what Cyril's been doing in that, but I can't tell you how much work Cyril and this committee has done. It's important to be able to have support in outside committees for council. You know, for one, we don't have the direct expertise that we have on this coalition, and we don't have the capacity, not with staff or council, to do all the work that's required to keep a close eye on this. So it's been a hugely positive, beneficial committee, and Cyril has just done hundreds of hours of work, like literally hundreds of hours, and we're thankful to him for that. And as I said, we want to be willing partners, and willing partners means we want to share information. So the recommendations that were shared with council have been shared with the department, have been shared with Dr. Megan Hayes, so that they can consider those as well, and hopefully those recommendations hold true in other areas of the province, and it can be a benefit not only for here, but for everywhere. And of course, the other thing is the recruitment and retention piece. You know, it's, we can do whatever we want. We can do as much as we like, but if we don't have access to primary care and we don't have a stock capacity of family physicians in this region, then it doesn't matter what we do. We're doomed. Really. Without the family doctors, and we hear it all the time, and I'm going to change course a little bit here now, I guess. You know, some places with no family doctors, some places with rotating doctors, locums, people, you know, coming on for short-term contracts. In Grand Falls-Windsor, we have family doctors still, but our numbers have dramatically reduced. We've gone from 25 to 30 family physicians just in Grand Falls-Windsor alone, and that number has been cut in half. In half. And we have more physicians now that are giving notice to their patients, as you may know, that their practices are going to be closing as well. So we have a huge amount of the population with no family doctor. I'll ask, how many people here are without a family doctor right now? Show of hands. Just as we expected. It's a huge number, and we don't believe that the numbers that are being presented in terms of people in central Newfoundland without a family doctor are correct. They're higher. We hear it from the professionals who are dealing with these issues every single day. And family physicians and family practice is the basis for healthcare. You have to have the stock of family physicians. But there are so many things, and you've heard about many in the news, that are making it difficult on family physicians and making it unattractive to be a family physician in Newfoundland and Labrador, Grand Falls-Windsor, or anywhere else. That is causing a huge, we're just falling apart at the seams. You can call it a crisis, a disaster, a mess, or whatever, but it is definitely the worst time in my time, and I'm sure many of your times, when it comes to healthcare and the worries and concerns that we have. You take a family doctor, okay? A family doctor is running a family practice. It's like running a small business. So they had to pay business tax, they have to carry overhead, they have to pay staff, they have to have extra expenses. And when you talk about the remuneration, that gets cut into significantly when you have all that overhead. Meanwhile, you've got other physicians who are working out of the hospital who are having all this covered. So why should the family doctors not have some subsidies and some help to have their expenses covered or find new ways? And on top of that, the administrative burden on family doctors, it's crazy. I saw the report on one of the news stories week and a half ago. Was it 18.5 million hours in Canada on wasted administration, unnecessary work that could be put on someone else? So you have these issues that are causing family physicians to burn out themselves. And we want to retain physicians and recruit them to come here, but the remuneration model has to be fixed, and we see work on that. And we have to have a climate that is fair across the board when it comes to physicians within our province. And a couple of things I want to bring up, and really, we could talk about this all night. And I was torn a bit on what sorts of things I would bring up as examples, and we look forward again to hearing from you. But we have all these people in our region now without a family doctor. So what do? Well, you go to the health hub, right? But a health hub is bursting at the seams. It's near impossible to get in to get seen. Well, what do? You call 811. You call 811, what do they tell you to do? Go see your family doctor. Or if you haven't got a family doctor, go to Emerge. So you got people showing up in Emerge in great numbers. And by the way, 811 don't share the notes with the doctors, so the patient has to start all over again when they get there to describe their situation and their problem. And they are in a situation where the emergency is already bursting at the seams in Grand Falls-Windsor. It has been for some time. And again, we're seeing health professionals who are taken to the limit. We got patients in hallways, we got long wait times, we got patients who are outside being treated in ambulances. And we've got ERs closing around us. It's commonplace now to see public service announcements from Central Health that, Conagra Peninsula Healthcare Centre, Bayvert Healthcare Centre, several others, and other areas of the province as well, closed temporarily. Lack of staff. So then you have these people in outlying communities who have to travel hours for an emergency. And where are they going? Grand Falls-Windsor, where is already no capacity to be able to take extra patients. I cannot tell you how bad the situation is, and I know and I expect there's probably some health professionals here or certainly have family members or friends who are. It is unbelievable how broken the system is right now. So, the health accord is supposed to fix that, and decisions are to fix that. With 811, as you would have seen in the news as well, that was something that was born out of necessity when it came to the pandemic. So that was a way for people to get access to registered nurses. So you have registered nurses who are the main people who are behind the phones, who are dealing with patients. And that 811 line is a private contract. So the private contract which went out on an expression of interest, costs us as a province over the next 5 years over $31 million. So $31 million for 5 years for the 811 line, that is going to serve around 72,000 calls. So you do the math on that, and it's roughly $82 per call we're paying for someone to talk to an RN who sometimes is able to help, and certainly not trying to criticize the RNs because they're great at what they do and it's not their issue. $82. Yet MCP is paying our family physicians $37 for an in-person visit. $47 if it's a virtual visit. And the private company gets paid more. If that 72,000 number gets higher, they get paid more, exponentially more. So that 31 million goes up. So you have to wonder, you know, when you're putting money into a service like the 811 line, how your family physicians and other physicians are going to feel. It doesn't matter what profession you're in or what your job is. If you feel like you're undervalued or you're not being paid correctly and others are getting paid more and they probably shouldn't, how do you feel? You're gutted. You're demoralized. And that is certainly what's happening with that particular instance. And not to mention the fact that most of these people who are calling 811 end up in our emergency department. So it's really, you know, the cost is hard to quantify, but it is high. But what I'm getting at is that that is money that should be directed towards getting a good core stock of family physicians for the hub areas in the province particularly. Because if the hubs are strong, the surrounding areas are going to be strong. And it's no different in Gander, Clarenville, you know, Carbonair, Deer Lake, Corner Brook. We all could be getting together and benefiting from a plan to get a core group of family physicians. But why are they going to come if that's the way the system is working? Beyond that, you may have heard recently in 2022, government went out for an expression of interest for primary care providers. And primary care providers are virtual. So not only physicians are they looking for in Newfoundland and Labrador, but also outside the province, who will provide virtual care. Those expressions of interest mean that, once again, we're likely to end up with a private company who are going to be paying physicians, likely taking them away from family practice offices and that, because they're going to be paying a lot more than our physicians are paying here, being paid. And we have a private company who is obviously benefiting from this as well. And I personally wouldn't mind that if the result was that there was no discrepancy in the amount of pay that these people are getting. So we need to have our voices heard. These are just some examples. And, you know, it's difficult for us to make a difference if that's the path that we're going down. And as a family physician who these days, it's not like, you know, years ago when doctors worked 70 or 80 hours a week and that was their life and that's all they did and they were there and everybody had a family doctor. Now, you know, people want work-life balance. They have family. They want some time off. They have to have time off in order to recharge and keep their own health. But unfortunately, for physicians, this is becoming more and more difficult. They're stretched to the limit. They're unable to have their own lives. They're in their family practice in the daytime, and they're treating patients, and then they may have to do an emergency shift in the night at the hospital. So not only are they doing these long shifts and back, by the way, to their office again the next morning, you have to wonder how much of an impact it's having on their ability to do their job. by having to put in those long hours. We have a situation now, and we got a provincial health board that's going to be coming in, and it's going to be the provincial health board's job to solve some of these issues. We need equity across the board. We need physicians to expect equal pay. I'll give you another example. I'm sure it's going to surprise people. An emergency physician in Corner Brook makes twice as much as an emergency physician on a shift in Grand Falls-Windsor. You've got physicians in central Newfoundland and other places who are going to Corner Brook and taking a week of shifts because they're making twice as much in less time.
It's higher in St. John's too.
Pardon me?
In St. John's, that's higher than any other emergency room.
Right.
The Premier's wife is emergency physician, I'm sorry.
So we'll have an opportunity for everybody to have a comment now in short order. But how can you expect any region to recruit and retain physicians when you have these big discrepancies? And as a human being and a professional, of course, you're going to make a choice that best suits you and your family and your lifestyle. So you end up with regions poaching physicians from other regions. It's going on. And then we talk about the traveling nursing program now, and how many RNs in the province have given up their full-time jobs because they couldn't take all the forced overtime and the long hours, and have decided to join private agencies to be nurses who are traveling around the country to provide care where it's desperately needed. But again, they're making way more money. And I know it doesn't all come down to money, but certainly it plays a part. And when you have those opportunities, you know people are going to explore them. And these are our health professionals, our nurses. The heck with recruitment and retention, we're talking about the ones that have been here for years already. And physicians that are giving up their practices because of the stress and the strain and the costs and everything else. When it comes to the new provincial board, and you know, I don't work in the hospital, I'm not a healthcare professional, but I know a lot of people who do, both retired and still working. The health authority needs to manage the facilities. They should not be making the decisions on primary care. They should go to the physicians and the health professionals who are in the know to come up with solutions and come up with the proper plans when it comes to the patient care and giving out the care to people in this province. But historically, it hasn't been the case. So again, you know, we want to make sure that we have as many people as we can in the region, banding together to have our voices heard, especially when we need strong, multiple voices. Just got to give you another one. The Central West area, Central West, is the only area in the entire province, the island, where a woman cannot self-refer for a mammogram. The only area. So a woman in Central West has to go see a family doctor to get a referral to get a mammogram. If you don't have a family doctor, you end up calling 811 or going to Emerge in most cases to get the referral to have a mammogram. So these are issues that have to be fixed. Why should women and people in this area be treated like second-class citizens? When it comes to health care, everybody deserves equal fair treatment. And that's what we want to demand, and that's what we want to make sure that you're going to help us in the future. It's no different with pap smear clinics that have been held here recently, and we've had a group of female physicians who are doing that, who can't do it anymore because the capacity is no longer there. You know, it's really a crisis. And I know it took us a while to call it that, but it indeed is. And we want to see positive changes in the future, and we do want to play our part, but we want to make sure that those decisions are being made for the right reasons. I'll just finish by a quick comment on the Provincial Health Board as well, because a lot of people are concerned about the amalgamation of the boards and how that's going to impact the various regions. I know Cyril had talked about the opportunities for people to be putting their names forward for regional councils. So we certainly would ask people to consider doing that. But when it comes to a provincial health authority, one thing that we would like to see, and we've met with Mr. Diamond on several occasions now, is a decentralization of services. So if you were to amalgamate the health board into one provincial board 30 years ago, 40 years ago, you'd likely have no choice to have large infrastructure costs, and you would have to amalgamate that in one area of the province. But thanks to technology, there are a lot of services that can be spread around the province. You got IT and purchasing and procurement and HR and a raft of others that no longer have to be at the same location. So for the sake of rural sustainability and from an economic perspective to ensure that jobs are in these communities across the province, then we want those services to be spread around, and we should, as Central Region, have a piece of that as well. And obviously it would avoid the unnecessary infrastructure costs. The last thing I'll say before we move into the question comment thing is, one thing that I haven't mentioned yet tonight is that the Health Accord states that there's going to be 3 main facilities in the province. 1 east, 1 west, and 1 in central. So originally, it wasn't determined where it was going to be in central, but we were vocal about that very quickly, as was Gander. And I spoke with Mayor Farwell, and we both felt that if either of our communities was to be downgraded to a community hospital, we'd be decimated. Just from an economic perspective, we got about 40% of our population that work directly or indirectly in healthcare. So we want both hospitals to survive and to thrive. But the one location in Central is going to be one location under 2 roofs. So that's going to be Grand Falls-Windsor, Gander, James Payton, Central Newfoundland Regional Healthcare Centre are going to be the main facility under 2 roofs. And what you've always seen, but you'll see more of, is a consolidation of services in one or the other, and a finding of efficiencies, I guess. And you think about orthopedics, if you break a bone, you have to go to Gander. There are services here that exclusively are here. And the Health Accord makes a number of recommendations, and the one that's been talked about a lot lately was the obstetrics. And as was said, we've been told that the result of the Health Accord is going to be 1 obstetrics unit in Central Newfoundland, where the babies will be born. That doesn't mean that the care is not going to be provided, or physicians are not going to be traveling to meet with expectant mothers, or emergency situations are not going to be able to be dealt with. That's not my job to tell you how that'll work, but it's the way I understand it. But the suggestion is, and the recommendation is, that that obstetrics unit be in Grand Falls-Windsor. We've got a stable OBS unit. We've got a core of professionals, we've got pediatricians, we've got the OBS obstetricians here, and we have surgery here. We have all the supporting things that means that this would be the logical choice. And I believe it will be, if it is to be one. And I know recently we put out some information from our perspective on that, and I hear from people who say, you don't want obstetrics in Gander. We're advocating for both places. And I said, if Gander had obstetrics being maintained tomorrow, I'd be happy. Both of us. Why not? I'd like to see everybody in the province have quick access. But we both know there's only going to be one. So if there's only going to be one, then the recommendations need to be followed and the fact-based information needs to be used. No different than the Centre for Aging Excellence, as Cyril had mentioned. It's recommended that be in Gander. Gander has orthopedics, Gander has geriatrics, and supportive activities and services that make sense for that to go there. So much to talk about. I'm certainly open to any discussion beyond tonight. I hope that you will email the coalition with any questions, concerns you have, or any councillors. All councillors here tonight, along with myself. And we'd be more than happy to engage to try to get answers to your questions or to advocate for your concerns. So what I'm going to do now is I'm going to ask Cyril and Holly if they make their way over to the table in the middle here. And before we get into the questions and comments, and we invite anybody to come forward to have some remarks, we just want to remind everybody that we should remain respectful in our comments, and that we're trying to get as many people an opportunity to speak or ask a question as possible. So I will moderate and try to keep it at a reasonable time. So I think a couple of minutes per person should do it, unless we have not many that are wanting to speak, and then we could take it a little bit further. And I'll just reiterate again, as I said, healthcare is not a municipal responsibility, so although I know people will have pointed questions about healthcare and healthcare delivery, we may not be able to answer those questions. We're not qualified, nor are we within that jurisdiction, but we can certainly listen to you, and we can certainly record what is being said and what is being asked, and to bring that forward. So without further ado, we're going to take questions from this side of the floor. See, Mr. Mercer is there by a microphone there now. So we'll ask people who would like to ask a question, or if they have a comment, to come to the microphone, and we will take it from there. Yes, sir. Brian.
I'd like to thank the town and the committee for all their work here tonight. Thank you. And I have a question. Why isn't there equal pay for equal work, i.e. emergency doctors from West, Central, and Avalon?
Well, that's the first one. That, of course, is directed at the person who can't answer it, because I'm not within the administration of health nor the government. But that's a question we've been asking. As we mentioned, that is a tremendous concern, because if we can't operate on a level playing field, and we're going to allow, you know, side deals and incentives and more pay to be happening right within the same province, the same authority, then it's not what I would suggest is fair. So I'm not able to tell you why that is the case, but I would encourage you to ask that question to the health authority and to government to see what answer you get.
Robert Butler.
My name is Robert Butler. I think a fair number of people in this room already know me, but for those who don't, I'm a semi-retired physician, whatever that means. I've been here for 34 years. Before that, I was in Steamboat Crossing for 11 years. So even though I look young, I'm really an old guy. I like picking on specialists, and I know Dr. Sullivan's here, so I love picking on him. I hope there are a lot of others here as well. However, to be serious, okay, I really believe in family practice. I feel it's done. Before I get to that, I'd like to thank Mrs. Dwyer and Mr. Farrell and Mayor Emanuel for the work you're doing. Obviously, their heart is in the right area. You've all done a lot of work, good work, and I really do appreciate it. And you said you want people to help. I'm ashamed to say I didn't know much about the Community Health Coalition, but if I could give any service, let me know, please. Because especially in the geriatric area, that's what I love. I also like to say that I'm representing myself only here now. I'm not representing the government for sure, and I'm not representing the NLMA. I think both people are important, very important in how physicians are paid and managed, but I think that the ball dropped, both of them. I want to expound just a little bit further. I don't want to bore you much because I know you've been sitting now for over an hour, but just to give you some idea of the disparities that are happening in this province. 46 years ago when I started medicine, most family physicians billed about between 75 and 80, were paid between 75 and 80% of what a specialist would. And I think that's reasonable. I think a specialist deserves more money. They work harder, they're in school longer, they're good workers, they're indispensable, but I do think that that was reasonable at the time. I have colleagues who are specialists now who make over 25 times what I made last year. 25 times, that's a fact. Okay? Why? Well, what's happening, the association, when the government allocates money to increase the physician budget, they give it to the association, the NLMA. The NLMA has a committee that sits down and determines where the money goes. The majority of people on that committee were professionals. So fair enough, but that's what happened. And the money over the years was every year going towards the specialists more than to the family physicians. Of course, after a while, if you keep putting more here and less there, the GPs are left. The latest figures I can get were in 2020. These are by MD Management, which is the financial arm of the Canadian Medical Association. The average fee-for-service family physician in Newfoundland, I'm being blunt here, okay, in 2020, made about $280,000 before any expenses. The average specialist made $500,000. Okay? So if you were a young doctor, just coming out of med school, where would you go? Would you go to family practice? Knowing that not only do you have a significantly lower gross income, you also have to maintain your own clinic. You have to hire staff. This is a very major. Let's go. Let me tell you another thing. Okay? Part of the overhead expenses, this is something that really bugs me. Part of the overhead expenses for any physician is their Canadian Medical Professional Association fees, which is a malpractice insurance. Okay? Certain specialties have very high premiums. And one in particular, I don't have to name what it is, but they deliver babies. It's $24,000 a year. Okay? The Newfoundland government pays all of that minus $800. Okay? So between about 94 and 97% of that fee is paid by the government. That's about 1/3 of what I made last year, gross. Okay? I'm being frank here. Okay? Now, meanwhile, family doctors, their premium is about $2,100 last year. We got $800 back from the government. Okay? So look at the difference. Okay, that's just one thing. Our fees for our the medical board, what we call the College of Family Physicians and Surgeons, or College of Physicians and Surgeons in Newfoundland and Labrador, are the same for all professions, over $2,000. Same. Now, whether you're making the same as physicians, or making $2 million a year, as some doctors are making, same fee. Now, do you see why young doctors coming out from med school are saying, why are we going family practice? You know? There are many other issues I can talk about which are dragging people down. I will say one thing about this, one more thing. I spoke to at least five young graduates recently from the family practice program in Memorial. Okay? And they, and none of them are going to community practice. And every one of them gave the same excuse: we can't afford it. This is true. Can't afford it. It costs so much to run a family practice, and you can go in the hospital, as Barry mentioned, and no overhead at all. None of that headache, hiring and firing staff, worrying whether the pipes are going to freeze, or the building going to be painted, or whatever. None of that. So what do? They graduate, they go into the hospital. So that's why you can't get runs, folks. Do you realize that 60% of the family physicians, physicians in the central region are American? 60%. Okay? I'm getting rusty, old, fixed my leg, I'm old. But I'm just trying to hold on to the family physicians that are here. I have a colleague who came to me. He said, "Man, I'm bummed. Can you give me a hand up?" And I said, "Well, I'll do whatever I can." So I'm going to have a day a week helping him, right? Trying to get him to stay. And this is the next thing doctor. And thank God for the former medical graduates. We didn't have anything with nothing. So folks, I can go on and on. There are so many things that Mr. Mangione didn't agree. There are so many things that can be changed, that can improve the life of family physicians, to make them happy again. You know, over 80% of us in Canada were in personal care homes and nursing homes. Over 80%, actually, we're not here. And where do we have the least mental health? Personal care homes. Okay, I was there 4 years in this big town. I was there 4 years by myself. I couldn't get anyone that could handle it. It got to the point where I had to get up. It was just too much work. I just couldn't handle it anymore. And I was worried that I was surrounded by people who did the best they could, but they weren't professional people. I had no nurses. The nurses practitioners, there's been a job for a nurse practitioner in the personal care homes here. It has been advertised for over 6 months now, and no one will take it. None of the nurses will take it. Why? Because they know how hard it is. They'd rather stay in the hospital. And this hasn't changed. Whatever the case, it hasn't changed. Well, I think I've said enough, but I think you're getting the general message. Thank you. Right?
Thank you. Thank you, Dr. Butler. And I guess, thanks for your candor, and obviously it speaks again to how unattractive it's becoming to be a family physician, but yet it is the basis of what we require in order to have a stable, good healthcare system. So the focus really needs to go there. And the mention of specialists now are taking on a lot of work that family doctors normally do. They have no choice, or they can refuse, and I guess in some cases that's happening, and it means it becomes even tougher. But thanks again, Dr. Butler, for your comments, and we appreciate it.
Good evening, ladies and gentlemen, your worship and the panel. Thank you so much for this opportunity. And for those who do not know me, my name is Kevin Shepherd. I've been a resident of this town for 47 years. And I've been living in this town, and I've always advocated on behalf of this town. Since my retirement 10 years ago, I became involved as a patient, and I didn't want to let people know that I'm not a healthcare worker. However, I am involved in some facet of healthcare. That is, I'm a patient and family advisor for cancer care in Newfoundland. And in that role, I represent patients. Those are the most important people when it comes to healthcare in this province. So thank you, Dr. Butler, for your comments with respect to the physicians and the issues that face them, and that is an issue that I continue to bring up when I represent patients at the Patient Family Advisory for Cancer Care. Along with that, I've also been asked to serve on the Newfoundland Labrador Cancer Council, which I agreed to do, and I've been working on that now for the last couple of years. I'm not going to get into all the details of that, but I will say that I'm on there because I am a cancer survivor. And being having access to care is so important to me. My biggest fear right now with the way things are going in healthcare in Newfoundland and Northern North is that patients are not being diagnosed at an early enough stage in their journey in healthcare, whether it be cancer or heart disease or what have you, because of the lack of primary care. Someone alluded to earlier that physicians, specialists are not being able to transition their patients back to family doctors. That is true. I've talked with a number of them, and it's a huge issue because they have no one when they're finished with the cancer patient or with the heart patient. There is no family doctor for them to send them back to. That's a huge problem. Having said that, I think at this time in our this stage in Newfoundland and what's happening, we have a tremendous opportunity with the health accord and with the transition to one health authority. I think the onus is on us as individuals to become involved, to make representation to the powers that be about your concerns, and to become involved by volunteering and helping serve on some of these boards, because the dollars are there to fund us for everybody to be paid for those positions. We need volunteers. This is what I chose to do a number of years ago, and I'm still at it. I hope to stay at it for a long time yet. It's very, very rewarding. It's a great opportunity to have your voice heard, and I had the opportunity to speak at to the group during the transition to the one health authority. And I firmly believe that these people are listening. I made my comments known as well there that my primary concern is people not being diagnosed at such an early stage in their healthcare journey. So take advantage of it. It is an opportunity. I'm very happy to see that the town is doing some collaborative work with other towns and what have you. And I think it's not a time to be greedy. I think it's a time for us all to work together to be able to make sure that we use this opportunity to be able to ensure that we have, in our seniors' years, which I am, that we have an opportunity to be able to have the best health care as possible with the money that we have. Thank you.
Thank you, Kevin. And obviously that, again, reiterates not only in the realm of cancer, which is very serious and much too common, but all across the spectrum, people are not being diagnosed early enough or at all. And I mentioned the mammograms earlier. You know, if you can't get a recommendation for a mammogram, you may not go get one, and then obviously the clock is ticking. But I think Kevin said it well when he said we have an opportunity. And we've said numerous times here tonight that we want to be willing partners when it comes to the implementation of the health accord, and it needs to be done in a cooperative approach, and people need to understand that there are going to be changes, and not everybody's going to be able to have everything. But again, that's why we're here, and that's why we want to continue to be a part of the process. Mr. Smith.
Thank you very much, Ron Smith. I'm listening to what you're saying and what's happening. I've got some concerns with all of these changes. One is, if you're listening to what's happening, communities are now putting in competition with one another to try and raise doctors to their community. Now we're in competition. Which town, which community can offer the most? And that concerns me. I don't know what that's going to cost us, but whatever it is, I guess we got to do it. We're in the fight. I guess we got to fight. I trust your committee will take that on. That's one thing. The other issue you alluded to, and I think Holly alluded to a little bit, is how the decisions are made and are they fair? One of the things that has hurt the hospital in Grand Falls very badly, I've been in this town for 75 years. 2 years ago, there was never a situation I ever had a family doctor. Grand Falls led this province as far as health care is concerned since 1920. We've always had a good hospital, we've always had good staff, and the last 2 years, that's all gone. And we've found ourselves in competition. I don't think it's a subject we should avoid. We found ourselves in competition with a hospital that was an electoral district of the Minister of Health. How do you beat that? Simply put, we did John Hagee to death. Now, somewhere along the way, the Liberal Party apparently, I think, saw him as an anchor. And he's fallen from the limelight, thank God. But it's really difficult. And I don't know how your committee is going to do it, but I wish them well. You've got to somehow get the politics out of play. And maybe one of the ways to do it, Mayor, you got to speak out more when the decisions are made in new fields that are based on politics and not the logic and the facts. Because we haven't heard as much of that as we should have heard in the last 2 years. This is a wonderful meeting. Thank you very much. I think it's 18 months behind schedule, but it's a good meeting, and you should do this more often, because the people not only need to be represented, they need to feel they've been represented. And we need you to speak out more on our behalf. But we can... So, we can't avoid the elephant in the room. And the elephant in the room is, unfortunately, we're next door to what used to be the Minister of Health, and that has killed us. So you're going to have to take a harder decision on the influence of politics. That's why I'm concerned with this one authority. It's going to be based in city towns at the will of the minister and the deputy minister. That's a real fear. And I don't hear that being addressed yet, so I hope your committee will lean on that a bit. But so anyway, I don't want to take your time, but don't forget the political end. We've been John Hagee, that's this province has, and I've never seen healthcare bad since we went. I appreciate the fact that everybody says we're going to allow us to die and we die here. But who has the vote said? We know that. And but I want you to pay attention to the political end, and thank you very much for the meeting.
Thank you, Ron. Just a couple of comments, I guess, and I agree with what you're saying. I can't tell you how many times I've been on Teams meetings and open forums and phone calls and that, and I know a lot of people can't hear it, but I've spoken very passionately and frankly about how I feel, and there's a ton of people that can back that up, and I'm not trying to defend other than to say this day and age, one of the challenges we have is reaching people. It's difficult. Like, the information dissemination is so disjointed. Like, how do you reach people? How do you reach everybody? And that's one of the reasons why we found ourselves here this evening. We have been spending a ton of time through the coalition and council in understanding that politics do play a big role, and saying it time and time again. And we will continue to fight for what is right for our community and our region, while at the same time understanding that everybody in the province deserves good health care. But that's why we need more people at our backs, more people who, when necessary, will send emails, write letters, call open line. That's what can be very helpful to us, and again, a reason why we're here this evening, because sadly, often politics does play a part, and we know that that's not what's going to be in the best interest of everybody in the province when it comes to health care and patient care. So thanks, Ron, for your comments. Did you have anything? Yes, sir. Go right ahead.
Thank you, Mr. Mayor and the committee, for all the work that you've done. My name is Derek Sharon. I'm the local pastor here, been for 3.5 years. And I'm the person that get that call at 2 o'clock in the morning, 3 o'clock in the morning. I'm very familiar with the situation here at the hospital. I grew up in this area, spent 20 years in business here, and spent 30 years in ministry, 16 in the U.S., where I'm familiar with the health system in the U.S. 10 years in St. John's as a chaplain and a pastor in their Eastern Health. And there's something that really concerns me is the length of time for service here. And I see that. One other thing that I want to add to your list here of the waiting time is losing a loved one in this fire in the hospital. That was sad. But we have one of our parishioners right now that have been waiting 3 months for a procedure and because it's not cancerous, he has to wait. He cannot get out and volunteer in our church and in the community. And he's not given any promise of in the next month or 2. He has to wait. Triage. Patients that he's dealing with right now in Corner Brook are now coming to Central because of the need on the West Coast. We're sending them here, so it's bumping him. So that's my concern. I see a lot of that here in our town, but I see a lot of good too. So. Thank you so much for all of your work and all of your time.
Thank you, Pastor Sharon, for the comments. Yeah, go ahead.
Hi, my name is Lexi McDonald. I didn't know if I wanted to talk to me, and I'm sorry if I get emotional, but my family has been through more than anybody should be in the last few years. In September of 2021, my wife went to a doctor in Harvey for pain in her leg that she knew was not normal. The doctor refused to give her blood work or x-rays, said that it was just muscle pain. She knew it wasn't. 2 weeks later, she died. confronted me. That doctor refused to give Grand Falls her death certificate. So we waited 9 days for an autopsy that never came because the coroner told us that if we waited any longer, we wouldn't be able to have a funeral service. I got 20 minutes with my wife. My children had 20 minutes. Before we had to say goodbye. And it's not fair. Something needs to change. No one should ever have to go through waiting 9 days for an autopsy when there was 30 people ahead of her. There was one person in the plan who could do autopsies at that time morning. And there was 30 people ahead of her. And he said, it's impossible. So we got 20 minutes and no one answers. And I can't do anything. And that doctor, we ended up quitting after that and moving away because of what happened to her. Because of the stigma that came from that. I don't know what your coalition can do, but I pray to God that nobody has to go through what we went through. But I know we're not the only ones who went through like that. But it needs to be said that something needs to be done. It's just too much.
Thanks, Lexi, and on behalf of everybody here, I'd just like to, say we're sorry for what you've had to go through, and I can't imagine, and unfortunately we do hear lots of stories that there's no hope, and hope is lost, and I think, across Canada, unfortunately, we know that to be true. What do you do about it? And, it's important that we start doing things that are going to make the patients first. And all the other things should be secondary to that. So thanks for your comments and your bravery getting up there. Anybody else?
All dinosaurs gonna have a few words now.
Very, I want to thank you and be committed to what you're doing. People that don't know me, I call myself a dinosaur now, if I had known I was going to this time, I just better hear about it. But, born and raised in Grand Falls-Windsor. I went through the healthcare system with my father and mother. I went through the Toomey Center and Carolyn and all that. But back then, I know back then, about 15 years ago, and mine around 8 years ago. And one thing I seen back then, the problem with the healthcare was too much management and not enough hands-on people. Right? But I'm going to die, I won't get over the bone. If I wasn't there for mom and dad, their life in the Toomey Center and in the Carolyn would be different. Sometimes I wonder with the people that are in those institutes and haven't got family here to take care of them, because there are people in those institutions that got compassion, and they're also, but the other end of the coin, there are people there that just there for a paycheck. So, what you were saying tonight regards of corner book and gold being merged on a doctor getting grandfather, whatever. As far as I'm concerned,
if you're in Merge or anywhere I know, or Town or wherever, everybody should be the same page. And I'll go into a committee, you know, but I'm from old school, I don't want no cell phone, and I don't want no email, right? Because just the way I am, it ain't changing, right? So, when you say thank you for doing what you're doing, and anytime that I can help out, I'm only a phone call away.
Thank you, Terry. I think it's, you know, fair to acknowledge something we all know. There's no easy solutions here either in a lot of cases. Like I know I hear all the time people calling into talk shows or social media posts and something's got to be done. They need to do something, they're not doing anything. And while I appreciate and I understand the frustration, the fact is that these are complex, complicated issues, and they require carefully considered, fact-based research to make the decisions. And it's why I had said earlier, and this is just a personal opinion, but I think when it comes to the primary care, the physicians and the health professionals should be more involved in coming up with those solutions, implementing those solutions, because those are the ones who know. And I hope that is something that happens, and we will certainly advocate for. We have about 10 minutes to 9 o'clock, so we will continue to give opportunity for anybody who wants to ask a question or have a comment.
My name is Harold Rice, and I seen this stuff 20 years ago. But as you were reading at the different pots we got going here, it all reverts back to one place. The government would rather save $1 than a life. They can do a lot more than what they're doing. They can send money for this thing, that thing. They can put more money into giving proper doctors. I got a doctor right now here for my life. I don't think you know what much driving. So the government should be stopped, and that's the reason why I'll stop them. Stop paying our taxes. And get rid of the government. We don't need the government. So I think they should put more money into getting doctors and nurses. The hell of making this kind of that. I just get some doctors that know how to do things. And believe me, I went through a lot of money. I was dead for a while. And I'm so glad I wasn't hearing you from my for that. Because they don't got doctors here that can do it. They don't have doctors here that could fit what was on my head at the time. And there's only one doctor in Ontario that knew what to do. And that poor man died of the same thing because there was no doctor to fix him. So we should get more involved with the government, but you should get this one more often and inform us more what's going on. Because there's a few things that were said here today, I guarantee you should take it right to the heart. We do need more help, and the government is not giving it to us. Not the liberal government or this government, that government, all governments. You got to be more strict with the government. They're put to give us stuff, but we want to take everything we got. That's all I can say. I report all over again.
Thank you, Mr. Rice. I guess, you know, to your point, we all know and we hear all the time about the massive amount of money that's spent on healthcare, right? Our budget in healthcare in Newfoundland and Labrador is somewhere around the $4 billion mark now, which is roughly 40+% of our overall budget. So I think it's well known, and again, it comes down to having people who know what the solution should be, being involved in the solution process, but the money just needs to be spent better. And family physicians and health professionals, nurses, that's where you start. That is the basis. You have to have that. All these other issues would not be as bad if you had that core of family physicians, and now we're really seeing it more than ever in the last couple of years particularly. Brian?
Yeah, I'd like to use my other minute. I'd like to say that I'm part of the baby boomers, and the governments have known that this is the biggest population coming through, and they've seen it for decades, and I don't think they're prepared for it. It's not just the healthcare system, but as we can see, the healthcare system, the wheels are falling off it, and we're competing from one town and another, and one province and another, and it's not helping. We need politicians of a federal and provincial level to start putting their money where their mouth is.
Thanks again, Brian. I guess should mention, because we didn't respond to it at all, the whole question around incentives. We've been trying to get creative in Grand Falls-Windsor, and our best way to do it and to have control over what we do is to have good programs, activities, events, facilities, things for people to do. So that's where we've been putting our focus when it comes to that. When it comes to incentives, and I know Patty Daly had asked me about this the other morning when I was on Open Line, about the incentives, and he pointed out Bonavista and how they're going after doctors now and offering service pieces of property valued at $60,000. And it scares me. I understand where Bonavista are coming from, and like was said, they've got to go and try to take care of their own, and that's what they see as the answer. But if this becomes a bidding war between municipalities, the smaller municipalities are going to lose eventually, and the bidding war is not going to help anybody. So again, it comes down to the province, federal government, and the health accord to address those issues that are prevalent, because you can't have communities competing against one another, trying to outbid the other with municipal tax dollars when it's not even a municipal responsibility, for one thing. So it is an important point, but we didn't speak back to it. 5 minutes. Dr. Dave.
Thanks, both for the excellent presentation. I'm recently retired. I practiced for 30 years here at Grand Falls-Windsor. I'm one of those evil specialists. Let me say that the problem, there's a whole host of problems that we've seen in the work over the years. But the most pressing issue is family medicine. Family medicine is broken. It's not that the family medicine practitioners, the doctors are broken. They're good people. They know their stuff. People like Dr. Butler and all the young people that are here in family medicine. The system is broken. Bob alluded to the unfair payment models. What we've seen over the years, and I've seen it, and we've all seen it in medicine, is special deals for certain groups of physicians, or special incentives. I agree the town shouldn't be in the business of getting into financial incentives. You're going about it the right way by doing these community events and making people feel welcome. And I think that's the way to go about it from a municipal point of view. With respect to the family medicine, there's some hope. The hope is in this document. This is a huge, comprehensive piece of work that Dr. Cartwright and Sister Dave put together, and it's a very big read and it's complicated. But they do, one of the main things that they're focusing on, and one of the main things that our committee is looking at, is community collaborative teams. Now that's a foreign concept to most of us, but this is a system that's worked in other jurisdictions, other provinces. And so it's the family doctor that's center of the team. And they're negotiating a fair pay model for these teams so that they'll be remunerated appropriately and fairly. But to be at the center of the team, and they won't be responsible for every little hangnail or runny nose or whatever. They'll have nurse practitioners, they'll have RNs, they'll have social workers, they'll have mental health workers. So that the family doctor doesn't have to deal with everything. He's at the center of it, and he receives all the information. And he's going to feel more fairly compensated, and I think this is going to be a slow process. It's going to take probably 5 or 10 years to come out. But at the end of the day, if this health accord is working the way it's designed to work, I think we'll all see improvement. So it's just going to take time. But we have to have some hope.
Thank you, Dr. Sutherland, and the contributions that you've been making to the coalition. Dr. Sutherland is right in that we have to have hope. And again, and I don't want to sound repetitive, but in my opinion, and I think council's opinion and the coalition's opinion, government and the new health authority, when it's active, really has to get out ahead of educating the public in Newfoundland and Labrador about what this document means and what the changes are going to be. You have to understand them, because in many cases they may sound bad in a particular area, but once explained and you understand that your emergency needs to be cared for and you still have stable health care despite some of these significant changes, then people will understand. And that's going to take a lot. Road, air, ambulance services need to be improved. Integrated health data needs to be improved. There's all kinds of improvements that need to be made, but if government or the new authority sits back and starts making changes, and people in Newfoundland and Labrador don't know what those changes are, what they mean, they're doomed. You're going to end up with a bunch of protests all over the place every time a change is made because people lack the information that they need in order to understand what these changes make. So I hope we'll continue to bring that to government as well. Okay, it's 9 o'clock on dot. I'd just like to finish by thanking everybody again for coming out. The event was recorded, so it will be posted to the social media channels and YouTube and things that we are able to do that, and wherever we can get it so that people can view it. We are likely, as a council and a coalition, going to have a virtual town hall in the future, whether it's healthcare specifically or a range of topics, because I like this forum as well, and I know council does. We talk about it all the time. Again, because it's so difficult to get your information, your message out there, that these are good ways to do so and have the public and residents have an opportunity to have their voices heard as well. So you will have a handout on the way out with some information. I would love to hear more stories. I know in many cases they're going to be sad stories, bad stories, but we want to know the experiences that you've had with healthcare and the concerns you have, the questions you have. So you can email the coalition, or you can email myself or any councillor, and we'd like to ask you to allow us to include you in a information group so we can keep you informed that way. Someone will have to call Terry. I'll call Terry Hand. But the rest, and I know everybody doesn't use email, so I joke, but I do find it difficult to reach everybody these days because of that. And we definitely want to have more people in our corner. And if you get that first email and it's something that you don't want to be a part of, just let us know. And we'll gladly take you off the list. But we'd like to grow our list too. So your family, friends, relatives, anybody that you think within the region that would like to be included, so that we can send out regular information on where we're to, what's being done, what the concerns are, what we may need from you, then we would have that at our disposal, and that would be a very powerful weapon to have. So thanks again on behalf of Cyril and Councillor Dwyer and all the council and staff who organized this tonight. We wish you nothing but the best for the next while until we meet again. So safe travels home, and hopefully we'll talk to all of you soon. Thank you.